Hi, this is Dr. Rogini. So today I'm going to show you how you can manage if you have issues with your hands, like grip strength, holding a cup, or even trigger fingers where you feel like your finger gets stuck. Okay, so most of the time I see this actually a lot in my practice, and I've seen where patients don't even realize that the problem can be coming from your forearm. Yes, sometimes the primary problem can be in your hands, but today I'm going to be talking about your forearm. Sometimes you also find patients with weak grip strength coming from the neck, but that's another whole story. But let me focus with the forearm. So I'm going to show you how the flexors work. So basically they go from the side of the elbow and they come across there into your wrist and your fingers. And then you have another muscle belly, another muscle that comes from here and runs across and straight into your hands. So basically you got a lot of muscles here, okay? That's what you need to know. But at the same time, you want to also know that you could find these tightness as you go along. You could find these trigger points. They're tight, hyper-irritable spots. So you might be very sensitive to these spots. So you can find them and then see where they are. And sometimes even if you push on them, you can feel the fingers flexing because that's how tight the muscle could be, okay? So once you find them, you can just get a little bit of lotion. So it's just a little bit. Even this much this is even too much. And then kind of go across. So what I usually do is use my thumb, come across, just kind of go across. The way you can help it is just kind of, you hold your thumb there, you're not moving the thumb, you're just holding it there, and you can just move with your arm there, okay? Just kind of crossing there. So you're assisting together. You are actually moving a little bit your thumb, but it's not too much. Then you can work a little bit more in this side, more in the lower, like the fibers that are here, and then more up here. So as you go down, you can feel the tension in there, and just make sure that you don't push too hard. Otherwise, you can actually bruise the muscle, especially if you're very sensitive to that. And you can also use, if you have issues with the other hand, so if you have, you need to use the other hand, just make sure use the forearm. So you don't have to use your hands all the time. So just kind of go with this and go across like that. I'm assisting with this one as well, so pushing together, kind of like that. A few passes. You don't need to go too many times, just a few passes. You don't want to do this every day. I've seen patients where you tell them to do this and they do too much, and then it could be it makes things worse. You can get very inflamed, okay? So, and then after this, you want to apply a little bit of ice just to bring the inflammation down, just about 5 to 10 minutes, not directly on your skin, over a towel. That helps you don't want to cause an ice burn. So you can also do some stretches. So what you're going to do is have your hands out like this. I usually do it this way. There's different ways of doing it. Oops. You can just just trying to get on the camera here. So bring your hands like this and stretch it this way. But just be careful. If you have other underlying issues, it might be a sharp pain, or you may experience spasms and stuff like that. So you want to test it first before you see. I'm already very flexible, but you want to test it out first and see if it's okay. You don't want to push too hard. And also always consult with your doctor or your physiotherapist just to make sure that this exercise and this stretch and this treatment is appropriate for you. Okay, and if you have any questions, please comment in the bottom. Just I will love to read that, and I can help you out with that. We actually also now we are doing now remote appointments as well, so you can book online, and we'll go from there. And thank you for subscribing, and we'll see you on the next video.